perinatal HIV evolution in a country like France has been an emerging issue since the last 90s in our care. And now adolescents and young adults are the majority of the perinatally infected children, so-called. So for example, in our hospital, out of our patient load of 115 HIV patients in current care, 83% are older than 10, 62% older than 15. And if we compare to the national cohort, out of the patients included, 88% are now older than 10 and 61% older than 18. So the first role we have in delivering in a hospital-based adolescent HIV care is the mandatory need of being a multidisciplinary team. And I would say that in my daily work, I've been really working extremely closely with my psychologist, Nadine Trocmé, and most of everything we did was teamwork. And we are constantly trying to involve all professionals, that doctors, psychologists, social workers, nurses, research nurse, secretary, into the specificities and the needs of adolescents. And with the turnover of staff, we always have to keep this kind of issue. The services are the same location, that is clean, friendly, standard, multidisciplinary. It's other specialties of pediatrics that are handed there too. And it's a model that goes with individualized care within that multidisciplinary clinic. But I rejoin what has been said earlier this afternoon by Marija, is that it's very important with adolescents to keep a holistic approach and consider what they are now and what they are to become, and helping them constantly with this process. So within that, it's very important to start with early and timely disclosure. This is the very first mark of respect to them as a child and then later on as an adolescent. Being interested in their family environment, in their school achievements, not only in how well they take their antiretroviral, supporting their personal projects, respecting privacy, building trust, and then later on assisting with the transition process, and also when they meet a partner, helping with disclosure, helping when they become a parent, also with parenthood skills. In terms of system, it's very important to answer adolescent needs with disponibility and flexibility, adapt clinic hours and visit to school and study requirements as much as possible. The hours of the clinics have to, and the days have to fit in order not to miss too much of their schooling. SMS recalls before the visits, making sure that if they missed appointments, these appointments are rescheduled, accepting drop-in visits. So all this needs disponibility. Of course, other basics are availability of condoms, pamphlets, educational material, and working with some dedicated associations working in the field of HIV and children or adolescents. But beyond that, which would be the basics, I would say now it's what initiative can be done to also answer the needs of these adolescents. Especially in the late 90s and early into the 2000s, we have led support groups that by that time were very needed to share the experience of the young people we had, and that was a psychologist. Later on, the nurses felt that there could be educational needs, especially regarding sexual activity and adherence, and nurses led those educational sessions on extra days, not when they were working as nurses. But also, it was also the creation of special events that were also very nice. Like a few years ago, we have been making a big gathering, which was called How Have You Been?, inviting all the patients that have graduated to adult care and who now are married or are living with companions and their children and living in their adult life, and meeting with also some of the staff from ours who have been retired, and the current staff, and the current adolescent in care. And this, for me, is a little bit like we saw yesterday the video of giving connecting the older to the younger and the next generation, I think. And a very important thing that has been nationwide has been creating and organizing nationwide adolescent forums. And we had to set a specific adolescent association to get funding and to make this forum happen. And in those forums that met about 120, 140 adolescents nationwide, it was a very important thing because in some places there are just 2, 3, 4 adolescents taken care of, and they discovered that they all look normal. They all thought everybody would read on their face, on their figure, that they would be HIV, and they say, they couldn't believe it. They say, this is HIV, they are HIV. How come it's possible? So it was a very important thing. And we kept recorded all what was said in proceedings, making little books out of what they say, and I just quote a few of those words, such as, we met each other, we shared an important part of our lives. It was really a golden moment. It tightened our ties. Another said, in African family, it's not easy to talk about HIV in our family, to sit and say, let's talk about the disease, how we take our treatment. So she benefits so much. Another said, before I didn't like myself too much because of that. There it was, wow, I had confidence there, I felt good. And another who became a nurse wanted to read the statement to everybody and say, let's make of our disease a strength, not a weakness. We should make our own future. So, and many, many more words. So this is an example of that party that was in the hospital. So it was really within the premises of the place where they have visits, usually. And they came with their kids. And so the important third part I wanted to insist on is how sharing that experience, how framing, how getting ourselves more competent in that creative and evolving issue. And so for improving our own understanding of all these novel issues and developing creative responses, we set up in the early 2000s quarterly reunions for professionals interested into adolescence and HIV. And we met, and they were clinicians, but they were members of associations, nurses, psychologists that came from France, but also from Belgium, from West Indies, and we gathered every 3 months, and that has been maintained for 12 years. We also organize workshops for health professionals, and this is supported by the National Society for HIV/AIDS on how to improve adolescent care. We also, in our hospital, have been holding a number of conferences dedicated to people who deal with adolescents, but not necessarily in the health fields, in the school nurses, in the people who work for protection of childhood, justice, health, different professionals to help understand better what is the reality of that they are living. Of course, the research on specific adolescent challenges and developing educational material with that research. And my main goal in the later years is trying to work with colleagues of adult infectious diseases to improve how to do young adult-friendly programming within adult services. And at the time being, for me, it's my priority in trying to network and work on talking in conferences and all that, trying to get them motivated in that aspect of. So this is one of the booklets we created for that, and that's one of the conferences pamphlets, and that's it.
Thank you.